Hi, I'm Dr. Emil Tompkins, and today we're going to be talking about chemotherapy-induced neuropathy. There are a lot of different things that can cause nerve pain and peripheral neuropathy. Most people think that it's got to be something like like diabetes or problems with your blood sugar, that sort of thing. But there are lots of different causes of peripheral neuropathy, and one of those causes is chemotherapy. Now, you all know we use chemotherapy for various reasons, but the most common is cancer. And so cancer being as life-threatening as it is, we will do just about anything to try to get rid of it. And you can tell we'll do just about anything because chemotherapy is very problematic and very troublesome. It's designed to kill cancer cells, but in general it kills cells, and so it can create lots of issues. Some of them can create damage to the nerve tissue, then leading to neuropathy. Here's why. There's a couple of different components inside many of the chemotherapy agents that can create some of the problem that we're experiencing. So number one is platinum agents. Certain things that have the heavy metal platinum in it. And any heavy metal is toxic to the body, and platinum specifically is neurotoxic. So it can affect the nervous system and start to create damage and create problems that way. So anytime we take something that is a platinum derivative, you have that chance, that possibility that you can start affecting the nerves. Now, one thing that I do want to make sure that I get really clear here is, even though I'm talking about some of the issues and problems associated with certain chemotherapy agents, in no way am I saying that you should never do that. As a chiropractor, I don't advise one way or another when it comes to chemotherapy, but when it comes to neuropathy, I do want you to understand why there might be that cause. So platinum agents, vinca alkaloids are very specifically linked and tied to neuropathy, and the other is thalidomide. Now, thalidomide is really interesting because there's a lot of history behind it. It was something that created a global dire effect in the 50s because what they found was that thalidomide was a sedative. It helped to ease an upset stomach. When women were pregnant and they were having morning sickness, thalidomide was an excellent medication at reducing morning sickness. The problem is there was an incredibly high concentration or a high percentage of babies that then were born with severe birth defects, severe extremity defects where they wouldn't have arms or legs, or their arms or legs would be incredibly short, so short that they were non-functional, and many of those babies died just days after they were born. This was an incredibly toxic chemical. So what they do find, though, is that even though that thalidomide was so damaging to those babies, thalidomide also is damaging to cancer cells. So if you're not having babies and you have the certain kind of cancer that responds to the thalidomide, you may get that medication. Unfortunately, thalidomide can cause damage to that nerve tissue, then leading to neuropathy. Now, some of these causes are fairly poorly understood at this stage. We just know that they do have a cause, and so it's just something to be aware of. Now, when you're dealing with cancer and you're fighting it with chemotherapy, for some people, there's a percentage of people that have the chemotherapy, and once the chemotherapy treatment stops, then the neuropathy stops as well. But there's a certain percentage of people that even during the chemotherapy treatment, once the treatment is over, that neuropathy continues. And for those people, the general prognosis is that you're stuck with it and it's going to get better. But I'm here to tell you that we see patients all the time who have had chemotherapy-induced neuropathy and have seen their neuropathy change and improve and even completely resolve. So we know that there is a possibility that we can make changes in those nerves, and that's what I'm looking forward to for you. So if you're suffering, I want to help. That's what we do here. I'm Dr. Emil Tompkins, and I have a pretty awesome ebook called 10 Vitamins and Supplements that can help you with nerve pain. Check it out, see what you think, and get some tools and strategies to be able to use supplements to be able to help you. It's all a part of our Total Nerve Pain Solution program, a very full-featured program that can help you with your neuropathy pain. Guys, I'm looking forward to seeing you get healthier and being free of your neuropathy, and we'll see you soon.